just might need to locate the file.
Is that yours?
No, that's mine.
Oh. There we go.
Thank you. I'm quite technically challenged sometimes. As you were sitting here, you probably read the screen and saw that the figure of 1.2 million people per year are said to be killed on the roads around the world. This figure varies greatly. Sometimes you see 1.3, sometimes I've seen even 1.4, but it doesn't matter in one respect whether it's 1.4, 1.3 or 1.2. Too many people are being killed or seriously injured on the roads. And it's a huge public health problem that we can only just begin to understand and work towards addressing. When I say we're just beginning, we've been working on it for maybe several decades, but it's certainly a problem that's been around since the invention of the motor car. Let me talk about this. What we know about it is that road crashes are predictable. Human error, human factor, the roads, the environment, all kinds of issues come into play, and that road crashes are fairly predictable. It's a complex environment in which we're using a motorised or even being a pedestrian. What we also know is road crashes are preventable, and we are addressing the problem today using good practice ideas and public health initiatives, and Dr. Pedden will talk to you about those. We're also talking about the deaths and serious injuries on the road are preventable. So by using different safety factors, by having 5-star road users on 5-star roads using 5-star vehicles, we know that serious injury can be prevented and the number of deaths reduced. You will also hear today that road traffic injuries are set to worsen. We will get an increase as the world population grows, as people become more motorised, and as people start to, be comfortable with travel and road travel. It's a complex environment, so we need to do something about this. So the Road Safety in 10 Countries project is an initiative of Bloomberg Philanthropies, and it's been funded by Bloomberg Philanthropies over a 5-year period, and we have a commitment of $125 million US. We work in 10 countries, and we are doing some interventions, and we'll also do global road safety reports too in that 5-year period. And that will be the remit of World Health Organization. So in those 10 low and middle income countries that have been selected, almost half of these, half of the world's traffic deaths occur on the roads. So we're working in Mexico, Brazil, in Russia, in Turkey, Egypt, Kenya, China, India, Cambodia, and Vietnam. We have 6 consortium partners working on this project. The World Health Organization is the coordinating partner. We have the Global Road Safety Partnership, whom I represent. We have Johns Hopkins International Injury Research Unit. We have the Global Road Safety Facility of the World Bank. We have EMBARQ from the World Resources Institute. And we have ASSERT, the Association of Safe International Road Travel. Each of us has a separate task and separate deliverables, but we need to collaborate together to get the best impact. So who works where? Johns Hopkins University International, what did you call it, David? ERU? ERU, GRSP and WHO, we work in all 10 countries. EMBARQ, ASSERT, and the World Bank facility works in 3 separate ones. The objective is to reduce deaths and serious injuries on the roads. So it's a pretty simple objective, but it's a complex set of tasks to get there. So what we want to do is to use proven public health and trauma care interventions. We know that this is not a transport issue. We also know that it's not just one single domain that can solve this problem. It's a multi-sector problem and there are multi-sector solutions. But we know that the proven solutions will come from the public health sector. We also want to identify high-performing, experienced local partners for implementation to ensure some sustainability and some replication of effort. We need to work with local partners. And we also need to rigorously monitor and evaluate so that we know whether we're making a difference, where, when, and how we're making a difference. And that is the role of the ERU. We're making some assumptions in starting this program, and that is that you don't need large budgets to have a large impact. And that, with small budgets, with small investment, we can make a big difference. And we'll hear a little bit more about that today. We're focusing on 4 key risk factors. If we can address these 4 key risk factors, then we will go quite some way into solving the size of the problem. One is on seatbelts, drink driving, reducing travel speeds, and wearing helmets, both for child and adult helmets. So what we are doing is, first of all, through the work of WHO, we're examining the legislative framework, and we have examined and identified the gaps in the legal framework, and we've identified laws that can be strengthened in relation to those 4 risk factors in particular. We look at the road safety management. We look for a lead agency if we can, and we find ways in which we can build the capacity of that lead agency to manage the problem, to manage the solution. So explicitly in Vietnam and Cambodia, we support the 2 key agencies that manage road safety. And we're also, as best we can, supporting the data management systems and the data systems so that we can identify where is the problem, who is the problem, when does the problem occur, and how best to address it. We also work through EMBARQ and the World Bank. We are working on the safer roads. The 3 partners that you have here today are largely not involved in that component. And we are working on building this safer road user component through capacity building and through training programs, using a train-the-trainer model where we shift the emphasis from an international expert into a local expert. We're also doing quite a lot of work today, and you'll hear from Margie about the post-crash care. We're doing some first responder courses and programs, that's largely through the National Societies of Red Cross and Red Crescent. Of course, there are also trauma care programs. There's a vital registry system and some data systems that are being established in a couple of the countries. We're not really dealing with safer vehicles explicitly. However, we are pushing where we can and advocating for safer vehicles, whether it be the regular vehicle that used by a family or through standards in other vehicles. Alongside those components, we undertake a social marketing campaign that is directed at the particular risk factor that we're focusing on in those countries. We're doing a larger and increasingly amount of advocacy work around bringing improvements. So we're looking at empowering civil society to push for changes that have an impact on the population. And we do supply a little bit of equipment, but we know that that isn't the solution. So just a small amount of investment in breathalyzers or speed cameras or some camera equipment, whatever's required, and particularly in the post-crash care area, we're also doing provision of some equipment. But of course, the larger component that we really have to pay attention to is the monitoring and evaluation, and all aspects of those components from the earlier slide. We collect some data on impact or effect, and we have some we feed that into the larger report so we can see whether we are making a difference. So what and where are we working? In Brazil, we're working on a program called Vida no Transito, and we're focusing on two main risk factors, which are drinking and driving and speed management, and we're working in the capital cities in 5 of the states. In Cambodia, we have been working in 3, the red, blue and green of Phnom Penh, Kandal Province and Kampong Speu in Cambodia for the last 2 years. This year we've added 3 new areas of Siem Reap, Battenberg and Kampong Cham. And in terms of capacity building, we're working with enforcement and social marketing on a national level, just not in these selected sites. In terms of, in China, we're working in Dalian and Suzhou with drink driving and speeding. And we're also looking at the how we can match those with the other Healthy City programs as well. In Egypt, we've slowed down our efforts here in Egypt for 2012 because of the unrest and civil unrest there. But we're going to continue to do some work in a nominal way on seatbelt wearing in the ring road around Cairo. And we will pick up our efforts once an election has been held and a stable government is in place. In India, we're working in 2 states, the Punjab and Andhra Pradesh. And our focus this year is on drinking and driving. We are looking also at helmet wearing in Hyderabad. Of course, helmet wearing is not something we can address in the Punjab because of the laws that are related to helmet wearing there. And we will also do some preparatory work on speeding. In Kenya, we're working in Naivasha and Thika, and we're focusing on helmet wearing and speeding. And we also have a fairly substantial trauma care component, and we're looking at a system of improving the data. What I can say is that we're also trialling a new system there of collecting data from crashes and the deaths and injuries by a unique way of working with mobile phones. So there's lots of nice little snapshots in each of the countries as we go around. In Mexico, we've worked in 2 cities for 4 years. It has been occurring for 4 years, but we've worked for 2 years in Leon and Guadalajara, and we focus largely on drink driving. This year we've added 4 new cities, and we are still establishing the work plan on how we will intervene in these cities. In Russia, we're having great success, and we're pleased to share that with you today. And we're working in Ivanovo and Lipetsk, both very, very different areas, socio-economically different and very diverse. So we're focusing on seatbelt wearing and speeding, and it's certainly having a good effect. In Turkey, we're working in Ankara and Afyon, and this year we're going to really work on seatbelt wearing and slowly introduce the issue of speeding. Vietnam, we're working in 2 for the last 2 years, Ha Nam and Ninh Binh, and we're adding 3 new sites again this year. What we can say is that in Vietnam, we're also having the social marketing and enforcement training across the whole of the country. So we will bring people into one site for that, for the training. So we have different stories in different sites, and we have different levels of success in different sites. But what we can hear about today is how we measure